Hello everyone, I just want to give you a heads up on this absolute bombshell information again. Maybe we're going to get it daily, but here we have a look at this date here, 12th of September 2019. Yeah, if you wanted absolute proof that this was a pre-planned tyrannical event to push global vaccinations, you don't need any more evidence than this. Global Vaccination Summit, Brussels, 12th of September 2019, 10 actions towards vaccination for all. Yeah, that was the agenda. We knew it was. I posted this a minute ago on Redwood's blog. I'll just put here, this is insane. This is insane. And then I said, what the hell are you going to do about this, John? This is utter tyranny. Okay? The European Union teamed up with the World Health Organization for this Global Vaccination Summit, 12th of September 2019, in parallel with Event 201. Read these 10 commandments of Big Pharma. You'll see that Big Pharma and Bill Gates, you'll see it's just utter tyranny. Basically, what they're describing here is a conspiracy. It's basically saying, in flowery language, make sure you bribe everyone, control the media, ban conspiracy theories. They're just using polite language and alternative words to say what I've just said. Okay, so 10 actions towards vaccination for all. Everyone should be able to benefit from the power of vaccination. They say here that we must sustain not to leave anyone behind. If you haven't had a needle stuck in your arm from Bill Gates and Big Pharma and the government, you've been left behind. And I've just driven through my local village, by the way, just gone 8 o'clock. Everyone's out clapping, obviously virtue signalling to each other that they watch the telly a lot. I mean, what else? What else are they doing? There's no NHS hospitals nearby to hear their clapping. Absolute, I nearly stopped the car and started. It's a good job I live on a boat, because I wouldn't be able to put up with that. If my neighbours were doing that, I'd be out, having a word with them. Okay, this is absolute tyranny. I'm going to quickly read you a little bit and translate it for you. Promote global political leadership and commitment to vaccines and build effective collaboration and partnerships. Okay, so that's basically saying bribe all the political leaders who collaborate and conspire with all these people, health professionals, authorities everywhere on a local, regional, national and international level. Which is, you watch the clip I've got for you at the end. Everyone is in the pockets of the vaccination Big Pharma people, and they just all reading a script, all of them. Even the countries that aren't on lockdown, that you think are possibly have got a bit of a freedom or a bit of autonomy from this big conspiracy. No, they're all in it as well, all of them. Sweden, the lot of them. Okay, ensure all countries have national immunisation strategies in place. Yeah, ensure all countries. How do you ensure all countries do this? Build strong surveillance systems. Yeah, great. Tackle the root cause of vaccine hesitancy and increase confidence in vaccines. Intervene in the discussion. So that will be probably like Unit 77 or something, the army propaganda people going in there saying vaccines are wonderful. Anyone who says otherwise is an enemy of the state. Harness the power of digital technologies and strengthen the monitoring and performance of vaccine programs. Yes, a lot of monitoring, a lot of surveillance, a lot of all these big brother words in here. Continue efforts and investment, including novel incentives. Okay, so basically number 7 is just basically bribe everyone, and don't just bribe everyone, but think of clever ways of bribing everyone that you haven't thought of before. Like free holidays to I don't know, China. I mean, it's in research, development and innovation of new improved vaccines delivery. Mitigate the risk of vaccine shortages by using taxpayers' money to buy up all the vaccine supplies. They've done that before with Tamiflu, and that's one of their tricks. But empower healthcare professionals at all levels, as well as the media. Empower the media and provide effective, transparent and objective information to the public, and fight false information and misleading information, including by engaging with social media platforms and technological companies. Yeah, is that why my videos have been removed from YouTube with doctors saying that vaccines are crap? Yeah, is that why that Dr. Judy has had all her videos removed because she's saying vaccines are crap? Okay, so that's happening. Align and integrate vaccination in the global health and development agendas through a renewed immunisation Agenda 2030. Okay, well, Agenda 2030, as far as I know, is the renamed Agenda 2020, isn't it? They just wanted to change it to 2030, so that by the time we get to 2030, everyone will go, oh, it happened in 2020. ID 2020. Okay, so this is absolute tyranny, absolute proof. The whole thing is a big, corrupt scam. Disgusting. You know, here's a load of coronaviruses floating around. They may as well be dollar bills, you know, with Bill Gates' face on them. Global Vaccination Summit, Brussels, 12th of September 2019. Okay, everyone's out clapping for tyranny. They're clapping for this. They're clapping for a conspiracy against them and a pre-planned staged event, which was this non-epidemic. Okay, and here's a little snip for you to show that they're all reading from a script all over the world. And we're in the shit. We've got to get rid of all of them. We need a global revolution. Well, I've got to upload some Forex videos for my Forex subscribers now, so please don't think I'm not going to cover the news, but I do have to upload some Forex videos because they're asking for some of my latest work in that regard. So anyway, here's some clips of politicians all selling out and reading the script.
Better diagnostics, treatments, and a safe and effective vaccine.
COVID-19 diagnostics, therapeutics and vaccines.
Largement du développement et du déploiement rapide de diagnostics, vaccins et traitements efficaces.
Universal access to vaccination, treatment and diagnostics.
Equitable access to new COVID diagnostics, therapeutics and vaccine.
We must all work together on improving diagnostics, accelerating therapies, and ultimately developing a vaccine.
We need to make vaccines, treatment, and diagnostics accessible to everyone.
Vaccines, treatments, and diagnosis will be the most effective way to do it.
We need new diagnostics, vaccines, treatments, and an equal distribution to all.
On equitable access to diagnostics, treatments, and vaccines.
And affordability of the vaccines, therapeutics, and diagnostics.
In order to develop adequate treatments and vaccines.